Okay, so good afternoon everyone. This is Phil Kenmore from the Open University. Thanks for joining us this afternoon for our webinar on developing the nursing workforce the OU way. I'm joined by some colleagues this afternoon in the room, so I'll just introduce them briefly before we get started. With me on my one side is Evelyn Mooney, who's lecturer in nursing from our School of Health, Wellbeing and Social Care. Hello Evelyn.
Good afternoon.
Nice to see you.
Thank you.
I'm also joined by two colleagues in the background, so I've got my colleague Gill and I've got my colleague Alison Smith, who are both going to be answering your questions for you as we go through, and hopefully at the end when we have some Q&A as well. So what we're going to do this afternoon, we've got about an hour, we won't talk for quite that long. We're going to talk just briefly, I'll just explain the structure of what we're going to do, and then basically we'll go through and have some Q&A at the end, but also you can type questions as we go in the chat on your screen, and Angela and Alison will attempt to answer those questions as we go as well. So feel free to do that as you go along. We don't have to wait right till the end. What we're going to do is we'll talk a little bit about the OU and the history of the OU very briefly, but particularly our history in nursing. Evelyn and I are then going to talk a bit about how we deliver the nursing programme across the 4 nations of the UK, both in terms of the online academic content but also the practice-based learning elements. We'll mention the recruitment and selection process. We'll talk a bit about the 4 nations, just about the variance between the 4 nations, and we've got a little video case study to show you at the end, and then we should be into Q&A, and we should have hopefully plenty of time, maybe 15-20 minutes for Q&A at the end. And of course, with the NHS Interim Workforce Plan being launched yesterday, we feel this is quite timely to be having this conversation today, the need to be increasing capacity for nurse education, the pressures around nursing across the country, across the whole of the UK. We're very pleased to be able to talk to you this morning, or this afternoon, sorry, not this morning, about how we do this at the OU. So let's get going a little bit. So first thing, I just wanted to say a little bit about the Open University. We're 50 years old this year, it's our 50th anniversary. As many of you may know, our mission is to be open to people, places, methods and ideas, and we're very proud of the fact that we are all about opening up education to people who perhaps haven't had opportunities for education in other ways. And we'll talk about that in relation to nursing, but we could also talk about it in relation to social work and other areas relevant to healthcare and social care. In relation to how the Open University operates and the size of the Open University, you may not know the Open University is the biggest university in Europe. We've got just about 174,000 students at the moment, and over 2 million people have been taught or graduated with the Open University. We have very good retention rates and very good levels of apprenticeships. We've got over 1,000 apprenticeships currently being delivered by the Open University in terms of the work we're doing at the moment since the levy came in England. So we've been doing nursing since 2002. Our first intake of nursing students was in 2002, and since then we've had about 1,700 nurses graduate from our programmes. We've got a retention rate of 91%, one of the best in the country. It's very high for the types of students and the way that we deliver our courses, which Evelyn and I will talk about a little bit in a moment. And we're in the top 6% of providers rated by the NMC, and as you can see at the moment, we've got about 1,450 nurses on our programmes, nursing and nursing associates, of whom about 330 are in apprenticeships. So the apprenticeship route is increasing significantly in the last year particularly, and we'll talk a bit about how that's working across the country in a short time. One of the things that's really important for the Open University, and when we work with employers both in the NHS and in other sectors, is about widening participation, and certainly the way that we approach nursing education in particular, we're very keen to make sure that we give people opportunities and access to train as a nurse that perhaps wouldn't get it from other HEIs and other opportunities elsewhere. So we'll talk a bit about that. We're going to talk a bit about how our programme is structured, and then we'll talk a bit about how it actually works and how we encourage people into nursing that perhaps wouldn't have had those opportunities before. A lot of our students are people already in employment. We get a lot of people that are healthcare support workers, for example, and where they're working for NHS trusts or others who want to encourage them to go into nursing and progress their careers. Obviously, there's different routes open to nursing now. We'll talk a little bit about the nursing associate later on as well, and actually how that works and how we can encourage people through that into full registration for nursing. So Evelyn, are we ready to talk about the programme? So what we're going to do We'll talk a little bit about the main nursing programme, which covers our nursing degree and also our registered nurse degree apprenticeship. And then we'll just also show you the nursing associate that's available as an apprenticeship in England as one of the routes into nursing. So what you can see on your screen at the moment, this is the structure of our current programme. And Evelyn, do you just want to talk us through how that works, the structure of the programme?
Yes, currently our programme, we have an adult nursing and a mental health nursing field, and it is broken up into 3 stages. Each of those stages amounts to a practice module and a theory module, and for each of those stages there will be, certainly for stage 1, it is over 12 months, stage 2 and stage 3 are over 18 months. Where the students will, with the support of their academic tutor and their practice tutor, will start to develop their healthcare support worker role and certainly starting to develop their skills to become a registered nurse. It does take 4 years part-time. Within the new curriculum, we are looking at learning disability and children's field of practice, but that is subject to validation with the Nursing and Midwifery Council when we're doing the new programme.
And so that new curriculum will be available through us from October 2020,
Correct.
Isn't it? That's
yes.
Right.
Subject to validation through the NMC.
Yeah.
Our whole programme is currently in the process of being written, but currently it is a 3-stage programme. It is 4 years, but come September 2020, subject to validation, we have the option of 3 or 4 years. So for employers, that is quite advantageous, but equally for students, some students want to study a bit more quickly, others want to take a bit longer, and we do have that flexibility.
And for those that want to do, for example, learning disability, we know there's a lot of demand from NHS Trust, for example, at the moment for learning disability. They can start this year and do year 1 and then transition to the new curriculum next year, which will be the learning disability curriculum.
What is unique about this curriculum currently is at stage 1 you do a practice-based module and, as you can see on the screen, and a theory module. So enhancing your healthcare practice and introduction to health and social care. Both those modules in their entirety, you can get what they call a certificate in healthcare practice. So a student who decides maybe after stage 1 they want to step off, they will still come off with a qualification. But we have written into our new curriculum that for those students, they will immediately transfer into stage 2 of the new curriculum. There will be a bridging type placement. It has, the finer detail is not available yet, but we have factored into our calculations that these students who currently start in September, because stage 1 is very generic and it's all about introducing health and social care, and the healthcare support worker is starting to develop their skills in general practice, and they will go out on placement. But stage 2 and stage 3 of the new curriculum is very much focused specifically on the field of practice, where the student will develop their skills within the field of practice that they want to practice in.
Fantastic. That's really helpful, Evelyn. Thanks for that. And just for those, we'll talk a bit about apprenticeships shortly as well, but just for those that are thinking apprenticeships at the moment, if somebody starts a nursing apprenticeship, for example, in September 19, we'll transition them from one apprenticeship standard to the other in October 20 when they transition to the new curriculum. So that's not a problem in terms of how we can do that. It's very easy to do. Okay, so I'm just wondering, Evelyn, if you want to say something about the placements and how we manage the placements.
Yeah, I think the most important thing about placements is that this is a partnership and a collaboration between the university and the employers and certainly the student. And the idea is that each student will have what they call a base area, i.e. the area where the student is currently, or the healthcare support worker is currently working. That will be called their base area. And then in the course of their studies, they will then go out on placements. The secret of making this all work is actually everybody working together to identify the placements. They all have to be certified, suitable practice learning environments. They all have to have an educational audit. So that at a local level is where our local staff tutor will work certainly with the employer and the ward manager to work out how best to manage the student's learning experience.
So that's a very close partnership. It's a very close collaboration.
Extremely, and certainly my experience would be is when you get to that stage, it's about creating the infrastructure at trust level and in partnership with the university, so both employer and university and student really get to understand what they're signing up for.
Fantastic. Okay, that's great, and we can answer some questions about that later on as we go, so we'll come back to that. So we just thought that, having talked a little bit there about the structure of the nursing degree and the nursing apprenticeship, the structure is the same, we just mention in relation to the English context the nursing associate apprenticeship, because obviously this is one of the new routes that people can take as a career development path towards full registration in nursing, and it's available in England. So we just thought we'd mention that, and we've just put the structure up of that for you. Evelyn, do you want to say anything about that?
It follows a similar pathway and similar modules to the student who is undertaking the nursing degree. Stage 1 again is 12 months, but for these students it's 2,300 practice hours split equally between practice and theory. The student will work in their core placement area, i.e. where they're actually currently working, but will have protected time and supervised learning with a registered nurse. And at least 460 of those supernumerary hours will be out in other placements to develop and evolve and develop their skills. Fantastic. To be able to register with the NMC after the 2-year programme.
That's great, thanks, Evelyn. And of course, for those of you that know apprenticeships already, you'll know there's a thing called an endpoint assessment at the end of apprenticeship, which of course adds a little bit of time on to the apprenticeship timeline while the EPA is done. EPA is called the endpoint assessment, and that applies, of course, to the nursing degree apprenticeship as well. So let's just talk a little bit then about how we do it. How do we deliver a nursing degree, a nursing education, which has an online element and obviously a practice-based learning element? So we thought we'd talk a bit about both of these, starting with the academic learning, which is primarily but not exclusively delivered online, because it's actually a blended learning approach, isn't it?
Yes. Academic learning, the student will be exposed, will have an academic tutor. That tutor will roughly have 20 students. They will work a lot in a virtual face-to-face world, as they work on what we call Adobe Connect, which is a platform where tutorials happen. So anything in preparing for tutor-marked assignments, for their end-of-module project, the tutors work very closely with the students in a group, but also there can be additional support depending on the students' needs.
And those tutorial groups actually become quite close, don't we? In the same way you'd expect in traditional university, they're actually seeing each other through Adobe Connect, they're connecting, they're talking a lot, they're sharing experiences.
Yes, we would say the most important thing that you have a laptop and a headset and access to the internet, and it is you're not physically in the presence of each other. It is a virtual presence, and there's quite a lot of innovative learning and teaching that happens on those forums.
Fantastic, and it's interesting that the feedback we get from students is that they do feel very connected to each other, and they actually don't feel isolated. It's almost the opposite. They feel very connected. They can share stuff, because of course the other thing you can do through the nature of the way our academic learning is delivered, that you can access it 24/7, can't you? Because those tutorials are recorded. They're available when you want to go back to them, whenever it fits with your shift pattern or whatever.
Correct, and certainly for lots of students, they would say, our students are very time poor, so they will be very good at their time management, and they will use opportunities, or they have protected time within their families to say, I'm spending this time to do some academic learning with respect to my course. But the fact that everything is recorded, students do get an opportunity. It is 24/7 in real terms, in that if you're a student on night duty, you may have your break. And we hear all the time about students, how creative they are with respect to how they actually do their learning. And our teaching is set up in such a way, it's small bite-sized chunks. It's not lots and lots of information, but it's very structured.
And what's interesting, when we mentioned on this slide here, you've got some of the elements that people use. They would use ebooks, they've got interactive and reflective activities, we've got lots of rich media videos and simulations, etc. We've mentioned the online tutorials, we've got forum discussions and activities, which are both synchronous and asynchronous, aren't they? So you can join some live, and others you can just post and wait for a response. And I know that the tutors are actually available outside far more than normal hours.
When an academic tutor is allocated to a student at the start of their journey, they will have a one-to-one conversation with the student and will agree how they're going to communicate, how often they're going to communicate, and different means, because sometimes email is okay for some people, WhatsApp. We try to engage with all modern technology and modern forms of communication, but essentially that is a professional relationship and a professional conversation between the tutor and the student.
And what's interesting as well, I mean, we mentioned on here the OU Anywhere app, which is our Open University app. It's an award-winning app, and basically you can use it live with Wi-Fi or whatever, but you can also download content and use it when you're offline effectively at any point, tablet, phone, whatever. We hear about people doing modules on a bus when they're on the way to work, or sat on the tube, or we had somebody sailing around the world on a yacht once, didn't we? In one of our courses, not the nursing course, I hasten to add.
No. I think when we're creating resources, we do pay particular attention to. We have the student at the centre of our how we are going to design the courses, and certainly from a Red Brick University to our OU route, students, as I said, were time poor, but we have created the timetable to be able to help the students systematically work through work, and it's manageable chunks of learning, for want of a better way of describing it.
And we talked about the blended approach to it, and there's the Adobe Connect tutorials that were like that, but there was actually some physical face-to-face, isn't there?
Yes.
Do you want to say a little bit about that?
Yes. For the practice learning modules, each student will get what they have a practice tutor identified, and that practice tutor will have 5 students to look after, and it tends to be students in the same area will have the same practice tutor. So there's a lot of local chats and working together. Geographical. We try to be as smart with respect to allocating the tutor to the student as close as possible.
So, sorry to interrupt, Evelyn, but in some cases, if, for example, a particular NHS trust, for example, or health board, whatever, has got a group of students, they might have that group of students together, but actually we might also take 5 individual students from 5 GP practices in, say, North London, and that would form a practice tutor group for North London. Okay, got you.
So it's sort of, for us, it's actually helped the students to be able to start develop their professional relationships with other students, but equally having the practice tutor close by does make it easier, although it's not always possible. There is a minimum of 3 face-to-face meetings per stage of the programme, but that's not to count the additional work that the practice tutor will do in preparation for getting the portfolio ready, for coming out onto placement areas. If the manager in the ward is concerned about a student not progressing, the practice tutor will come out. So there is, whilst it's a minimum of 3, it is usually more, and it's certainly very student-led in that some students will need more support where others will manage with just 3.
And I think what's interesting about this, when you go out and talk to people in the health service about how we deliver nursing, you realise that there's an online element to this academic learning that's very flexible, incredibly useful for people that have got busy lives and shift patterns or family life, etc. But at the same time, we've got a local presence. We've got local practice tutors all over the country, all over 4 nations, always available geographically to actually meet with the students.
Yes, and within each of the localities, we will also have like a senior program manager, and they are called the staff tutor, who coordinates all of the local arrangements for their group of students. And one of the things that we also do is we bring all our students together at each stage, Stage 1, Stage 2 and Stage 3, we will have a dedicated induction. So all the students get an opportunity to meet. The employers are usually invited to that meeting, and it also gives them employers an opportunity to work with the university in a collegiate way.
Which is fantastic, isn't it? And we've got, we'll come back to it in a bit, but we've also got teams that work supporting the employers and the employer parts of this, both as you know, helping them with their students, but also, for example, in apprenticeships, helping them manage the levy and so on and so forth in an English or whatever context. Okay, so that's a bit about how we deliver some of that, and we'll talk a bit about some of the detail of practice learning in a second. We just wanted to show you a couple of things that the students see, for example. So this is a shot of student home, which is the core place, isn't it, Evelyn, that students go to when they start their course and they start working through the modules.
Once they get their personal identification number and they get registered onto the course, this K101 is the first module in Stage 1 of the nursing degree programme, or nursing apprenticeship.
And so as you start working through that as a student, I mean, what people get is they basically get a calendar, don't they, that helps them week by week?
Yes, each week is identified, and it sort of just brings the students through in real time. So if you look at this welcome week, it says the 6th to the 12th of October. So there'll be lots of setting up activities in that particular week, getting the student used to using the resources, getting used to doing some study skills, getting used to the library. So we're very focused on making sure the students have the tools to be able to start to use the resources. And then students that's their plan. They have to then manage their time with their work time and family time, but it helps students, it just gives students a guide to start. Now, some students will do lots of it and then stop for a while and then go back again, but it's a very individual learning pathway. But our structure does, we try to make sure all the weeks are covered, bearing in mind that students do have holidays, and then we have the assignments and all. So they're able to plan work, and
so we give them the structure to use, but of course they need some discipline and application to use it. But it's interesting, isn't it, that whilst the structure is there, the flexibility is immense. So if you're working in an environment that's particularly busy during January or February, you can perhaps do less work then and more work later, providing you're within the timeline allowed overall.
Yes, and as long as, obviously, when you look at assessment, like the assessment TMA1, you have to actually read down. So your first assignment is about what you've already read and learnt and understood, and it's applying that theory into practice and being able to sort of satisfactorily complete the assignment. So students do have their own ways of learning, but primarily we try to focus on, there will be times when students are going to be busier at other times than others.
Fantastic, okay. And so we've just got one more slide on this bit, which basically just shows an example of the sort of interactive activity that you'll have. This is sort of based around real case, sort of looking at real cases, isn't it? Real patient or carer experiences. And you've got a video to watch, you've got questions to answer, and this is quite a common structure, isn't it?
Yeah. Certainly from how we do our teaching, we would certainly introduce topics, and I imagine in this case that there will have been some teaching and learning about diabetes, anatomy and physiology, and how to manage the condition. And then what we try to do with the activities is actually about applying the learning and developing further. So hopefully the student, by the end of that activity, will have a greater understanding. So the tasks are really, really important, because that's how we help the students understand where their learning deficits are, but equally they can see where they're progressing and doing really well, because this can be used then to action plan in practice. I need to get more experience on a particular aspect. So it
makes that direct link from the academic learning to the practice learning.
Yeah.
Oh, brilliant. So do we want to say a bit about the practice learning, how it works?
Well, practice learning, now, currently each locality will have a slightly different way of doing it. I can speak for Northern Ireland in that we have a very structured practice placement, proper placement. The student will be a healthcare support worker and then will go out on a 6-week placement like our other colleagues for the other 2 universities. But I do know from my colleagues in the other parts of the UK and with employers, depending on needs of service need, 15 hours a week can be practice learning, and then the rest of the time then is spent as a healthcare support worker. But the important thing about this is practice learning is organised to suit the employer's needs for delivering service, but equally for the students' needs to get experience. But the critical part of that is about the collaboration and the partnership. And as long as the hours are met at the end of the programme, and for student nurses that they're supernumerary, that they're not counted in the allocated numbers, there is a certain amount of creativity about how we support student learning, but it has to be done in consultation with the employer and also the university. Ultimately, we have to meet the regulatory requirements.
Of course, yeah absolutely. So what this is showing us, the slide here, we're showing effectively the wrap around the student of all the support and the support for learning that goes on. And some of this is supporting the academic learning, some of it's supporting the learning in practice and the practice, the skill-based learning that's happening while students are in their placements, etc. So if we just talk a little bit about this, I mean, we've mentioned the academic tutor who leads the modules. We've mentioned the practice tutor who provides the local support and is liaising with the employer about how they're learning their skills in practice. We've got a student support team that will support students for any of the things you would expect them to need around the pastoral care and all the other things they might need around administration and so on, anything, or even digital skills.
Yes, but certainly with the student support team, we actually have a registered nurse based who consults with that team. So if a student rings up and has a concern and it's specifically around the nursing programme, we're really giving, it's not generic advice, it's actually giving very specific advice to help the student achieve and succeed.
Oh, that's great. Okay, so and then of course we know that the line manager has a role, and we've got the mentors, practice assessors. They've all got a role, which presumably everyone will understand. Quite often, the employer, the NHS trust, or whoever has an organisational lead, an organisational link, and that can be quite an important role for us, particularly, for example, in relation to apprenticeships, where it's quite important to have an apprenticeship lead within the trust or within the organisation. And we have a team within the OU that specifically deals with apprenticeships. Nursing, social work and some of the other apprenticeships we do, and will liaise with the organisation to make sure that the apprenticeship levy and all the other things around that are being met. We've also got, you mentioned the staff tutor or the local programme lead. This is the person that's coordinating across a geography, a region, and that's quite a helpful link for employers, isn't it? Yes,
and that is a very critical link, the employer link and the staff tutor programme, local programme lead. That is a very critical conversation, or very critical relationship, in that if the employer has any issues, it's straight to the staff tutor. But equally, if the staff tutor is finding things that aren't going well for the student, it's sort of like that, being that advocate back to the employer. And certainly, if we're not meeting regulatory requirements and supernumerary isn't being achieved or maintained, but for me, it's if you start to work with the Open University, that's what we do really, really well at the start, in that we develop those working relationships and we really get to understand what each other's roles are. But primarily, we know what we want to achieve, and that we want to get the students to the point of entry to the register, the NMC register.
And what I think is interesting is when you listen to stories of OU graduates and you talk with them about the experience they've had, the amount of support they get is quite amazing. It's quite intense, isn't it? There's always support there, and we're very encouraging of people. We spot very early if people are struggling, don't we? We can see on the interactions they're having, we can feel it through the practice tutors, and we're quite keen to help them quickly and help their employer help them.
Yes, and to be fair, I think despite the fact that we're not face-to-face with the academic tutors, yes, the practice tutors will see the students. Very quickly, the academic tutor will pick up if the student is struggling. The secret of that relationship is that we do need students to sort of speak up for themselves, to share if things aren't going right, because we will have an answer and there's always a solution. And it's about developing the students' skills to be able to raise an escalated concern, but that's for practice as well. So starting to think about themselves, and how they look after themselves and manage themselves on the programme. It's a two-way process.
And what I think is interesting is that we do offer quite a lot of build-up support for people as they're about to go into programmes. So we often have employers talk to us about what we call a soft start, where we offer free, completely free resources around learning how to do academic study again if you haven't done it for a long time or perhaps have never done it, learning how to do digital online study, for example. And there's loads of resources like that. I mean, people do use those, don't they?
Most certainly, and certainly if you're thinking, I would have to say the programme, it's 4 years, it's hard work in that the student is having to juggle so many different balls, but the rewards that the student will get by putting the time in at the start, really getting to understand how the technology works, how the platforms work, and through doing those courses that there's no requirements to pass or fail, it does give the student an opportunity to feel comfortable with the resources.
And what's interesting, just to finish off on this slide, I mean, one of the things that we definitely see in terms of the nature of students that we talk to employers about taking and we then see through the course, I mean, our ability to help with widening participation in gender is quite significant, isn't it? Because we can take students who perhaps have not had educational opportunities, but this level of support allows them to do it while they're working, perhaps, while they've got family commitments, while they've got shift commitments. It allows them to go through and have all that support to get them through to qualification and become a very, very successful nurse.
Yes, and again, I suppose the help is there, and it's about how we prepare the student at the start of the journey to access the support and help when required. So we're all part of that journey.
Fantastic. Thank you, Evelyn. So we just thought we'd say a little bit about recruitment and selection, and obviously we can talk in detail to individual employers about this at any point. And there is a little bit of variation depending where you are in the UK, etc. But we'll say a little bit about that, and then we'll quickly move on. We've got a little video case study to show you before we get to some Q&A, perhaps at about another 5-10 minutes or so. So recruitment and selection, Evelyn, I mean, we've got quite an interesting process. It is different to other HEIs, and it gives people access, but it's also quite robust, isn't it?
Yes, it is different in that you do not have to have GCSEs or A-levels. The minimum that the NMC require for entry onto any nursing degree programme is functional skills level 2 in maths and English, and declaration of good health and good character, and then your criminal records check and occupational health clearance. But we do expect quite a lot of our students. They have to go through a formal application process with personal statement. There's a panel interview, there's a written task, and the service user question. So it's a process that is done in partnership with the employer.
So it's a very joint process, isn't it? And we recruit together with employers. Whether they're, I mean, we are recruiting now some external candidates in some places, but mostly it's people who are existing workforces.
And we do select for values and experience and not just academic achievement. And I can certainly vouch for that. The most important thing is that this criteria is set by the Nursing and Midwifery Council. So from an OU perspective, we are meeting the regulatory requirements. But employers are very much part of this process because they get involved in shortlisting, service users get involved in reading the discussion tasks, and obviously practice placements are all quality assured. And so again, it's a two-way process, but the recruitment selection.
And I think what's interesting being out, talking to lots of employers around all the 4 nations is that working with the Open University is quite a useful adjunct in nursing, sometimes to other local universities. So sometimes people are recruiting, their sort of 18, 19-year-old intake with the local university, but they've got certain types of existing staff or other recruits that they feel that our approach would suit better, and it would help them get through to registration. And
we would certainly, I know from my previous experience that more and more young people have been put off going to Redbrick universities because of the stress around the fees and moving away from home, and lots of young people, well, we're certainly seeing a downward trend in age where there are young people coming into work as healthcare support workers and then deciding in consultation with their manager through their CDSA or their appraisal process that they would like to have a career in nursing.
Oh, so it's a fantastic opportunity. So it's a really useful way of doing it. And I think what's interesting on that is the fact that we do work with employers who are commissioning or effectively working with multiple universities, multiple higher education institutions, and that's fantastic. So we thought we'd just say a little bit about the 4 nations, because of course the Open University is a 4 nations university. We're one of the few that work across all 4 nations, sort of, in terms of that whole UK approach, but also with local teams in each geography, both in terms of the nations, but also across the regions of England. But there are differences in nursing, aren't there? And some of those differences are relatively significant about how nursing is commissioned, about how it works. So I'll mention one. I've mentioned it already. I mean, in England, obviously, we've got quite a strong apprenticeship agenda. There are elements of that in Wales and Northern Ireland, but effectively, you've got the nursing associate, for example, in England. You've got the registered nurse degree apprenticeship in England, and that's a little bit different. You've got commissioning of nursing places in the other nations. From
Northern Ireland, Wales and Scotland, it's very much the strategic direction of the chief nursing officers and the Department of Health to recruit students to the work-based learning degree programme. So it's been quite a big strategic drive from 2015 in all 3 nations, and certainly Wales is our newer partner coming on board.
That's the most recent one, isn't it?
Northern Ireland has been reasonably well established, as has Scotland, but numbers in all 3 areas have increased.
And that's quite interesting, isn't it? That obviously we've seen a lot in the plan released yesterday about the English situation, but of course the volume of nurse training in Northern Ireland, Scotland and Wales is increasing quite significantly at the same time, isn't it? Both with the OU and other universities. Yeah. Is there anything else about the differences? I mean, we mentioned, I think, earlier that in Wales, we're going to be offering access to the private voluntary independent sector from September 20. Is that right?
As far as I know,
yep.
yeah.
Okay, so that's a slight difference happening in Wales.
Yeah.
So that's a bit about the Four Nations, and we are very cognizant, being a Four Nations university, that there are differences. So whilst we've talked about apprenticeships, for example, and other things in this discussion, we're very conscious there are differences locally. So if you are in one of the other nations, if you're in Northern Ireland, Wales or Scotland, it's absolutely worth talking to your local OU team about how it sits in your context and what the differences are in your context, and you can guarantee that we'll be closely involved with the governments of all parts of the UK.
That's correct.
So what we've got for you now, I'm going to say this before I click the slide because it might play immediately. We've got a little video case study for you. This is only a couple of minutes. It's very short. And this is about a guy called Lee who actually is doing a registered nurse degree apprenticeship, but it's an example, of course, of just doing the nursing degree itself. And this is a fantastic little case study about somebody who's gone on from being a healthcare support worker into nursing. So let's just play this for you. It's literally just under 2 minutes.
I work with the urgent care and assessment team. We travel out and go and visit people in their own homes. We also look at psychological treatments to prevent hospital admission and hopefully improve their well-being. I've been working in a support worker role for the past 26 years and I couldn't really progress any further. So that's when I started the pre-registered nursing degree. That would open up a lot more opportunities to be able to expand my practice and move forward.
Lee came into the programme as what we call a self-funding student, which showed absolute commitment. And then when we were ready to move forward with our apprenticeship model, Lee was able to step onto the apprenticeship at stage 2.
When he came for interview, he performed exceptionally well. It was very patient-centred and gave me a huge confidence about how he would cope with the programme. They do have to be very independent and very self-motivated, but it's very flexible.
The Open University module material, being online, has helped me be more flexible, and the support is there. There are forums that we can be involved in, and quite often there are online tutorials. We're able to have a chat with the tutor and other students. The Trust support me as well. They're investing in staff to develop their skills because it's about improving the service that we offer. What I learned on the practice days, I could immediately put into place in my normal work days. Once I've qualified, I'm going to be very proud of what I've achieved. And my family, they'll also be quite proud of this. And it's something that I encourage my daughters to work hard at the things that they enjoy.
Okay, so I think you're back with us. The video's finished there. So just to say then, just to finish off, and we'll go into questions. So we talked hopefully a bit about the flexibility and the approach that the Open University takes. It is different, and at a time when there is discussion in a wider, for example, in English context about using more of an online approach for academic learning. Of course, the Open University is already delivering a form of this. It's a blended learning approach. We have a very flexible approach to online learning combined with a local tutor team that will work face-to-face and with the students, as well as academic tutor support. People can be flexible in terms of how they study 24/7 around their shift pattern, their family, their other commitments. And of course there's the opportunity for nursing and nursing associate apprenticeships in England as well. I think what we'll do now is we'll move on to questions. So we've got some questions coming in through the chat already, but if you'd like to ask any specific questions, and what I'll do is I'll just ask Andrew and Alison to sort of fire at us some of the most common or the most important questions that have been asked, but do please keep typing away while we answer some of these. Evelyn, let's see if we can answer the questions. Let's see how we do. Andrew.
Okay, so we had a question from Bev Clancy. Who arranges the alternative placements?
Okay, Alison or Evelyn, do you want to?
The alternative place, when I talked earlier about the partnership between the Trust and the university, so it would be the local staff tutor with the Trust employer link, and then with the number of students, depending on where you live and depending on the relationships that you have with the other universities, practice learning experiences. I can talk for Northern Ireland, say there are 3 universities in Northern Ireland, and we sit in September, March and June, July time, and we actually plan where all the students from the 3 universities are going to go. So that is a bit of a logistical nightmare in some respects, but it actually is quite an easy way to manage the practice learning. But most importantly, it just means that you don't have 10 students in the ward at one time and then there's nobody for 3 months. So it's not probably the best answer, but what it is it's a very critical question that you ask if you decide that you want to pursue working with the Open University, because we can sort that out at a local level. It can be worked depending on local arrangements.
And interestingly, I mean, obviously working, for example, some of the big English NHS trusts, we know that you go to those meetings with those employers and they're already working with a range of HMIs, and there's already a conversation about where the placements are and how they work. So it's really a collaboration, isn't it? The answer is it's about doing it together. I think the days of a university trying to organise that for an employer are probably not really there, are they?
No, and certainly my experience is that for each trust in Northern Ireland, we would have identified all the practice placement areas that have been audited to take students on placement, and the number of students that can be accommodated, the number of practice assessors that are available. So there's lots of variables that you have to consider when you're trying to answer that question. But that is actually a collaboration between the trust and the university.
Fantastic, thank you. And another question from Lorna Gray. Where do students learn their clinical skills and who provides this?
Fantastic. So clinical skills, where do we learn the clinical skills?
Well, clinical skills, first and foremost, students will learn the theory around lots of their skills in their theory modules, but then we use clinicalskills.net, and students will be asked to be involved in certain activities and will certainly be directed to activities to develop their theory and understanding around the skill. The best place where a student will learn their skills is actually out in practice and during their practice placement, working with their mentor or practice supervisor. And certainly from a student's perspective, it's in those early days identifying where their deficits are or where they need to build their skills, so that the manager in the ward knows and the practice supervisor is aware that the student needs to develop the skills. So it's a partnership between the student and the practice supervisor, but the student is bringing with her the theoretical knowledge, and she will learn to apply that in practice. So hands-on practice in the learning environment like any other student.
So effectively we're saying the academic learning draws through the element of theory. They bring some skills with them if they're already working in the environment, for example, which a lot of our students are. We use skills.net to draw some of the simulation, but then effectively we're pointing them towards working with their practice supervisor to learn those skills in practice during their placements and making sure they're getting those done properly.
And we have to remember that this workforce is coming with a skill set, and that it's really sort of reminding the student that as you become a student nurse, you're coming with a level of knowledge. So we're moving moving the students from just teaching them how to take the blood pressure, but now to actually give them the why are you taking it, what's the interpretation of the... So it's those professional conversations that we're starting to develop with the students.
Fantastic. And it's interesting, isn't it? I mean, the feedback we get is that our students come out very confident, very competent, and actually, very successful as nurses. And we've got such a high retention rate to show that. Angela, next question.
Okay. So this question relates to, and we're going to try and cover off 2 questions in one here. So somebody asked earlier about when are we introducing the new standards? Is it this year or next year?
Okay.
And under the new standards, how are mental health nursing students going to gain the required physical health skills required in the new standards?
So I'll answer the first part while you think about the second part. So the new standards are being introduced by the Open University from 2020, September 2020. And as I said earlier, you can start in September 19 because the first year can be done as a generic part and then transfer onto the new curriculum next year. for example, if you're going into learning disability or children's, which we're starting next year. So that's the answer to the first part of the question, probably the easy part of the question. Evelyn, on the second part, do we have an answer?
I think we have. What I can say at this stage, it is very early days with respect to our development of the new curriculum, and I can't give a prescriptive answer except to say that I do know the three nations, Wales, England and Wales, Scotland and Northern Ireland, have got dedicated groups working, and we have OU representation on all those groups as we have in the localities in England. So we're at a stage where we are working locally with employers, with all the stakeholders, to be able to get the feedback, and certainly we have had a number of stakeholder events where employers are saying, this is what we want you to teach the students. We are now at that stage as like, how are we best going to deliver on that expectation? So it's a work in progress, so I don't have a definitive answer, but it is being discussed and we are having those conversations.
So the curriculum is being developed for September 2020, and we know that the way we develop curriculum is very interactive with employers, with working groups and with stakeholders. And so effectively, I think the answer really then, as you said, is that we're working on that, but we know it will be taken account of because the curriculum will deliver all the things it has to deliver, and we'll make sure that works. And
the NMC require us to evidence that we have worked with external stakeholders and with employers and with service users. So it's probably not, I don't have a definitive answer, but it is something that is very high on our agenda.
Fantastic, and will be in place by September 20.
Okay, so a question here from Kate Morgan. With the HEE recent focus on student wellbeing, what support does the OU have in place in addition to recognising the role of the personal tutor, manager and mentor, thinking specifically about an early warning system to identify students concerned around student wellbeing, and what, as an HEI, you can share with employers to ensure that staff are safe?
Well, that's a great question, and wellbeing is very high on the agenda, and it's something we're very concerned about and we pay great attention to. I mean, we talked earlier, when we had the slide with the circle of wrap around the student, the support that we put in place, how intense that support is, and certainly how much time and effort we put into our student support services to make sure there is full wellbeing support. Evelyn, do you want to say something specifically around nursing support, around the wellbeing and the pastoral care element that goes on?
I think pastoral care takes a number of forms. Certainly in practice, the student will be supported by their manager, a mentor and their practice tutor, and certainly the academic tutor. Everybody has been trained with respect to safeguarding, and our student support team are very aware of students who are struggling. We are piloting the use of the big white wall now. It's a very new initiative in the OU. I don't know very much about it, but the plan is that it will be a resource for our students to be able to engage with, and it's totally confidential to everybody else. So it's too early to know, but this is again one of our key topics because we have to evidence to the NMC that we have thought about students' mental health, and we have thought about developing their resilience and their emotional intelligence and helping them with their career choice, and also making sure they get a good student experience.
Yeah, okay, fantastic. And we know that the student support services that we have, which apply for all our courses as well as nursing and social work and others, are very available to people 24/7, but also very intense in terms of the level of support they will offer when a student flags that they're struggling or that perhaps they've got some issues. That they're very quick to offer some support.
Yes, it has been. Well, we do have students who, there will be students that will have mental health issues, or we have to put reasonable adjustments in place. But that's no different to any other university or any other organisation with respect to supporting and giving everybody an equal opportunity to succeed. So I think the question is a very good one, and I certainly it is on our agenda, and we are being very cognizant that we need to sort it out. Now, I would have to say we do have 91% student satisfaction to how we currently support our students, and we are very apt at picking up students who are always, certainly an example would be if a student's always asking for extensions for their assignments, or they're getting things in late, or they're not joining the forums, the tutors, the academic tutor or the practice tutor, will very quickly pick up that student and certainly offer some one-to-one support, and we have that facility available.
I mean, just on a slightly related but not directly related point, I mean, we also have great support for people who've got some sort of registered disability.
Yeah.
I mean, the Open University has the largest number of students with a registered disability from any university in the UK. I think it's about 25,000, and we're very, very supportive of people who have any form of disability of whatever sort.
Yeah, and certainly for our modules in production, we do have to be very cognizant of the fact that students will come with a collection of, there's some best practice out there, and we have to make sure that we do things in different formats and whatever. So we are cognizant of those issues.
Okay, fantastic. Angela, next question.
So the next question, I'm just reading this as we go. When existing healthcare support workers apply for the nursing associate course, is there any recognition given to their existing experience so this can be used to reduce the 2,300 practice hours?
Okay, so I'm looking at my colleague Alison, wondering if Alison might answer. She's an expert in our nursing associate course. Alison, if you could speak up, we might hear you in the...
Okay. In terms of practice hours, whether it be the nursing associate programme or the registered nurse degree programme, we could only do credit transfer for practice hours if they've previously done a study of a foundation degree such as the assistant practitioner or the nursing associate programme. The one other main sort of exception we've got is that Evelyn alluded to earlier on, is we have got, the OU has got the higher diploma and certificate in healthcare practice. That is particularly used quite a lot in Northern Ireland, and the practice hours from there could be used. But otherwise we can't, because a lot of the time, again, we are governed by the NMC regulations and rules.
Yeah. Fantastic. Thank you, Alison. Great answer. Evelyn, anything you want to add? Or?
No, that's covered it.
Great. Thank you, Alison.
With the new NMC standards, we are needing to train practice assessors and supervisors. Our local HEIs are supporting us with this. Are you also able to provide educational support for these vital new roles?
At the minute, I can't give a definitive answer, but yes, we locally within the localities across the UK, we will be actively involved with employers in shaping up what the practice supervisor's role is going to look like, how we're going to support students, how we're going to support the assessors. But we will be part of that discussion. So that will be a local arrangement whenever we get to the stage of working out what it's going to look like in practice. But we are there at the table at those conversations.
And what's interesting is, I mean, we've had previously free resource on we have a free platform called Open Learn. If you Google Open Learn, you'll see that free platform. It's got about 10,000 hours of free content on it. Previously, we've had free resource on there, and we're developing new resources for those roles under the new curriculum. So, for example, we'd expect to be able to offer something for practice assessors and supervisors that would be on that platform, and that you'll be able to access to learn how to do that and basically go through the process of understanding the role.
And I suppose currently for the program we currently are running, we do have the mentor website. So exactly. And we have free access to that. So there are resources currently there that can help the current workforce develop their mentoring or their practice supervisor skills.
So the answer to that is, in short, yes, we will.
Yeah,
we're developing it as we are developing the new curriculum. So I think we've got probably time for another question. Just one more.
Last question then. We undertake placement audits for our current HEIs. Will we need to do additional ones for the OU as well?
No, because certainly my experience is that I'm speaking for Northern Ireland again, the three universities agreed that whoever took the lead on the practice placement audit, the other universities accepted it, and we had a regionally agreed practice placement audit tool. So I do know across the country there are local groups working on standardising the practice placement portfolio, the educational audit tool. So if one university does it, the expectation is that the other universities will accept it. So we're just part of that bigger picture of practice learning and making sure the learning environment is safe for students.
Fantastic. Okay, so I think we're just about coming up to the end of the session. I'd like to thank Evelyn for her time. Thank you very much, Evelyn, for your input there. Angela, Alison, thank you very much for coordinating the questions. We do hope you found that useful. The entire webinar will be available online, and we'll be emailing those of you that have joined us a copy as well, but obviously your colleagues will be able to access it. And if you'd like to learn more about the Open University in Nursing, please just Google Open University in Nursing and you'll find our nursing pages. We have staff in all of the regions, all of the nations and all of the regions of England. We'd be very happy to come and talk to anybody who's got any questions and would like to find out more. Thank you very much for joining us.